Hello, good morning, everyone. Hope you guys all had a good weekend. Probably busy studying, I can imagine. We are going to just do a quick review on test one for today's class. And of course, the test is on Wednesday, and there are no class on Wednesday. You just have to do your tests that day, and we'll resume our lessons in the following week. So let's get started. By the way, you guys have the test review package, right? You can get that from eCentennial. You know what? Just in case you don't have it, let me post the link in the chat box for you. Just give me 1 second. Okay, so it's in the chat box now, if you need that. All right, first question. Label the different layers of the fractionated blood in the diagram below and describe components found in each layer. Fractionated means the blood has been separated, right? You put it in a centrifuge and you spin it down, and the contents will be separated based on the weight. So heavier things will sink to the bottom and lighter components will flow to the top. And that's what the tube is going to look like. So what do we call this yellowish portion? Anybody? Just trying to make this a little bit more interactive than our usual lessons because it is a review. That's correct, plasma. Sorry, so I'm going to put right here, plasma. Probably going to zoom in a little bit because there are a lot of things we have to write. Plasma. And plasma makes up approximately 55% of your total blood volume. Now, what is in this plasma? Well, you should know it is mostly water with dissolved ions, nutrients, wastes, and proteins. Okay. We call these plasma proteins, right? So please give me some examples of plasma protein. Anything will do. We have learned so many of them throughout the first unit. What are some examples of plasma proteins? Yeah, that's correct, Shelley. There are the albumins. Right, so albumins, which is the most abundant one. Most abundant plasma protein. And the function is to maintain osmotic pressure. Okay, we have a few other ones. Let me just scroll back a little. Okay, hemoglobin, Riz, is it's in the red cell, so it's not normally found in the plasma. When you have hemoglobin in plasma, actually it indicates that there are some hemolysis going on. So normally we would not find that. Thank you for bringing that up. Actually, there's a lot of people with that misconception. Okay, so that's albumin. We have prothrombin, fibrinogen. So let's separate them into different categories, maybe clotting proteins. Okay, so if you're bleeding, we would need clotting factors like prothrombin and fibrinogen. And you should remember the cascade, right? The coagulation pathway, starting with the thromboplastin, and then along with calcium, it activates the prothrombin into thrombin. You should review that pathway. You probably will get a question like that. where you have to reorganize the steps. So that's that. And what about for immunity? What kind of plasma proteins do we have for immunity? I mean, Shelley said antibodies. Yeah, but what else? Anyone else? Antibodies is a good one. The anti-A, anti-B, all those things, right? That's in the plasma, you might recall. What else plays a role in immunity? Yes, complement proteins. Okay, so these are also made in the liver, just same as the albumin, right? And they stay in the body for immune surveillance, and you can activate them when there is pathogens in your system. And the complement proteins will help enhance other immune responses, right? Such as phagocytosis, such as inflammation. So those are the key things that you will find in your plasma. Over here, we have a layer that's kind of between the plasma and where your red cells are. That's called the buffy coating. Buffy coat. And what is contained in this buffy coat? What are the two cell types that we find in the buffy coat?
Platelets.
Platelets, thank you. I think that was Leah. Anything else? Platelets and, oops, I spelled it wrong. Platelet. And one more. WBC, that's right, yeah. Yeah, and a few other people as well also mentioned the white blood cells or leukocytes, that's right. So platelets helps with coagulation, of course, and the white cells helps with immune response, and together they make up approximately just 1% of your total blood volume. And as far as white cells go, we have the granulocytes. Granulocytes, which are cells that have visible granules, and hopefully you remember what they are. There are the neutrophils. We'll talk about their functions later on. I mean, we'll review their functions later on because you already learned them, right? Eosinophil. There is the basophil. And remember, even though we didn't introduce this next one in lecture 2, but we learned that later on it's related to the basophil. What's the name of cell that's related to the basophil in terms of, you know, the kind of response that they elicit, the kind of response that they trigger?
Mast cell.
That's right, the mast cells. Thank you. So the difference is the basophil is able to circulate throughout the body, and the mast cells are more localized, right? So that's for triggering local inflammatory response, if you cut your finger kind of thing. Basophil is more like systemic, when you're having an allergic reaction to something, and it causes systemic inflammation. On the other hand, we also have agranulocytes, which are the other classification because you cannot really see their granules. And that includes things like monocyte, which you should know by now. They can differentiate into macrophages. But there are also various types of T cells. Okay, T cells. Sometimes they're called T lymphocytes, just in case you see that terms in the test. And then B cells, which are also called B lymphocytes. The test questions are not just created by myself, right? Like there are several people teaching the course. So that's why sometimes the wording, it's a little bit off. Well, not off, but like, you know, it's different from the way that I usually teach you. So you know, if you see terms that we don't commonly use in class, that's probably why. But you know, I've tried to look through all thousands of questions and make sure that they are things that we have talked about. If you ever encountered a question that you feel like it's totally way off, it's something that we haven't talked about and you think it's unfair, you can just send me an email, and you know, I can look into it for you. Okay. Just like some people actually email me about the self quiz, right? There were a bunch of questions that that involves things that we haven't talked about, and then so I removed those from our course shell. And if you haven't tried the self quiz yet, you definitely should give it a try. Okay, finally, this stuff, it's just RBC, red blood cells, or erythrocytes. And this portion of the blood, when we spin it down, when we fractionate it, we call it hematocrit. And that makes up approximately 45% of your total blood volume. And since we're on the topic of red cells, let's just write down some features, some characteristics that you should know about red cells. They have no nucleus, for example. They contains hemoglobin, which is the oxygen carrying molecule. They have a biconcave shape, which allows increased surface area for like better gas exchange, right? Lifespan, how long do they live for in the body? Yeah, about 120 days, very good. And when they do die, they get broken down in the liver and spleen. Okay. And there is one other thing that we should probably remember about RBC. There's something called EPO, which is from the kidney, will increase RBC production. Okay. Say air is thinner, you're staying there for a couple of days, that would trigger your kidneys to release the EPO, which then increases your RBC production. Right? We talk about how we can use EPO to treat anemia that is as a result of chemotherapy or as a result of dialysis. You can give these patients EPO to boost their RBC production. Okay. And just like, I have no particular plans for the review. I'm just writing things down as they pop into my mind. So, it's going to be all over the place. The platelets, the white cells and the red cells, they are produced by stem cells, bone marrow stem cells. Through the name of the process is hematopoiesis, right? Hematopoiesis. Okay. I'm just looking at the captions that I'm generating through Zoom. I keep on saying hematopoiesis, but they're not picking up that word. Guess it's not part of their dictionary vocabulary. All right, so that's that. Are we good here with the fractionated blood? That was just like a quick review of all the layers. Hopefully it makes sense, right? Okay. All right, what if I show you this picture on the Brill as EPO is used by cyclists illegally? Yeah, I think like if an athlete use EPO is considered as doping, they probably will test. It's one of the things that they screen for, like in the random urine test. I think I did read something about it. Wasn't sure if it's related to cycling. Maybe, but yeah, it's definitely illegal. Yeah, blood doping, exactly. Right? There's all kind of things you can dope with that in competitive sports. Okay, if I show you this picture on the test and I ask you, what's going on here? First of all, which one is the normal one? Hopefully hopefully you can tell one of them is normal, one of them is abnormal, right? So which one is the normal one? The one on the left or the one on the right? Yeah, like this one is normal, right? Like you can see the plasma, the yellow part, and then you can see the hematocrit. I mean, it's not as um the proportion is not as obvious as this one, where you have like half and half roughly, right? This one looks like the person doesn't have a lot of hematocrit, so there might be some other problem with the guy. But over here, like this one is the abnormal one, right? The one on the right tube, if you compare the two. So what's the problem here? Anyone want to speculate? These are like real things people do, right? Like they collect a blood sample from a patient, they spin it down, and then they see this. What's the problem? Yeah, Brill said it's hemolysis. That's right. So this is hemolysis, massive hemolysis, right? What that means is the red cells have burst, okay, and so many of them burst open that the hemoglobin is now in your plasma, and hemoglobin is what makes your blood red, right? So normally they are restricted within your red cell, but because the red cells all burst open, now you have hemoglobin in your plasma. So what would trigger something like this? Why would there be massive hemolysis? Any guess? Reason. So that's the diagnosis, hemolysis. What are some reasons that would trigger hemolysis? Even though there are no short answer questions, right? Like I could give you this question as a multiple choice, right? I could, list out different scenarios and you have to know which one is the probable one. Anyone want to guess? Receive blood transfusion that not match. Okay, that's a good one. Yeah. And go ahead, Leah.
No, it's the same thing. I was supposed to say wrong blood type in the wrong system.
Yeah. That's a reasonable suspicion. So mismatch. Blood transfusion. Okay, so there is some a cross reaction going on, cross reaction leading to agglutination, right? And then hemolysis. Another one, and anyone else want to guess? Pathogens. Yeah, in some very extreme cases, your blood can be infected with something that causes these red cells to burst open. But it would have to be like a bleeding disease, right? Like something like Ebola, for example, that causes um massive internal bleeding, basically. And that's actually the one I was thinking about. Okay, so there is some kind of internal bleeding. Okay, and if this happens, the person would be severely um, anemic, right? Their hemoglobin level would be very, very, very low. I mean, they would all be in the blood, so they're not really doing their job. If you check the hemoglobin in the red cells, it would be very low, and definitely you will need to perform some kind of transfusion. Maybe RBCs are abnormal. Unlikely, because like if the red cells are like abnormal, they might not just burst open on their own. Like that would have been like a chronic situation, right? Like Not that I'm aware of. There's no condition where the red cells all of a sudden become abnormal on their own and then start bursting. Yeah, but good. Just like hypothesizing here, right? Like, I mean, we can't make an accurate diagnosis just by looking at the picture, right? There are other things that we have to look at, right? Maybe we have to look at their their electrolyte concentration, right? Remember last semester we learned about those hypertonic, hypotonic, isotonic stuff, right? What kind of solution would cause your red cells to burst open? Do you remember that from last semester? Lecture 4, membrane transport. Yeah, hypo, right? So maybe exactly hypotonic. So maybe, if the person is the blood is really diluted, it's also possible that would result in hemolysis, right? Okay. So a bunch of stuff, but anyway, these are all good good guesses. And we don't really know. We have to check for other stuff. All right, let's match some babies to their parents. I believe there are some matching questions on the test. We've done quite a bit of practice in class already, but this is good to go through. I don't know if you guys had a chance to try this. I'm just gonna take it up, okay? If you can write down the answers and do it on your own later. For something like this, we have to remember 4 things, right? I'm just gonna verbally refresh your memory. Individuals who are type AB blood will not have type O babies, regardless of who they marry. And individuals who have type O blood, they will not be able to have AB babies, regardless of who they marry. And 2 individuals who are type O will only have type O babies, and 2 individuals who are type Rh negative will only be able to have negative babies, right? So keeping in mind those 4 things, we should be able to, use process of elimination. So let's take a look at the first one. The first one is A and O. So we know it's not this one because O cannot have AB. They're both negative. So we know it's not this one because this one is positive. And also, right, there's no B in either of the parents. Impossible for them to have a B baby. And based on the information we have right now, we cannot decide definitively whether it's I or K. I'm just gonna write those down for now. Okay. Moving on. Now we don't even have to go in order, right? Some of them are easier to do. Like for example, this one has A, B, and O. So if it's A, B, cannot have O. If it's O, cannot have A, B, and they're both negatives, that means they cannot have positive baby. So this is baby K. Right? So immediately, baby K is chosen for the last couple here, which means it's not K for the first one. Okay, so I and K are gone. Let's take a look at the this one here. B negative and O positive. O positive cannot have AB baby. So J is their kid, right? And that leaves H for the second one. Okay, so you don't have to go in order. Always try to work with couples who have like A, B, or O in them, or if they're both negative. Those are the good ones to pick from because it allows you to eliminate a bunch of choices right off the bat, right? So that's the answer key. Does anybody have any question about matching babies? How could they have H? Sorry, who? Oh, this couple? Yeah, so I know, right? Some of you might be thinking, well, they are both positive. How is it possible that they have a negative baby? Remember, positive can be homozygous positive or heterozygous positive, right? So if these are like positive, negative individuals, then there's a 25% chance that their baby is going to be negative, right? Does that answer your question, bro? All right. Anyone else? Okay, next one is like a application question that really messed people up on the test. So let's just go through it together and make sure that we have good understanding of it. A new blood type called fluffy, I just made that up, okay, has been discovered in humans. There are three, oops, there's a spelling mistake, sorry. There are three alleles. There are three alleles in the fluffy blood group, F1, F2, and F3. F1 is dominant over F2 and F3. F2 is dominant over F3. How many different phenotypes are there in the fluffy blood group? So before we do phenotypes, we probably should do genotypes. Okay, so how many genotypes are there? Okay, why don't you take a moment and write out the genotypes? Okay. We'll take it up in a second. Okay, so 6 alleles. Anyone else? I mean 6 genotype, I'm sorry. Does everybody agree that there are 6 genotypes here? Yeah, okay. So let's list them out, right? We can have, first of all, there are 3 alleles, F1, F2, and F3. So you can have 1, 1, like F1, F1, that's one genotype. You can have 2, 2, 3, 3. So those are the homozygous combinations. You can also have 1, 2, 2, 3, and 1, 3. So that's it. Those are the 6 possible genotypes. There are no other combinations, right? 3, 2 is same as 2, 3, right? It's not about the order. It's about which one you have. All right, let's take a look at phenotype then. Phenotype. So we will call the phenotype like fluffy 1 or fluffy 2 or fluffy 3. So let's say fluffy 1. Okay, so which one will be fluffy 1? Well, 1, 1 is going to be fluffy 1. And the question says F1 is dominant over F2 and F3, which means when you have 1 and 2 together, 1 will show up. So that's also fluffy 1. And when you have 1 and 3 together, 1 will show up. So these are fluffy 1. And for fluffy 2, it will be 2, 2 or 2, 3. Because 2 is dominant over 3, right? Dominant means it will always be expressed, right? And the one that it's being recessive, it's not going to show up. And so the only way to have a phenotype of fluffy 3 is 3, 3. So the answer is 3. 3 phenotypes here. Does that make sense? Do we have any questions here for 4A? You will have a question like this on the test, guarantee, okay? So please make sure you understand this before we move on. You guys are so quiet. All right, let's do the poll here for part B. Right, the same fluffy situation, but then but then all three alleles are co-dominant with each other. How many phenotypes? Right, so let me know. Let me give you some choices. 3, 4, 5, 6. Sashano asks, is there an easier way to tell how many? No, this is the easiest. This is the most straightforward way. Sorry. There's no magic formula, unfortunately. Okay, I have 8 responses. What about the rest of you? Come on, choose something. What are you gonna choose on the test, huh? If you see something like this. Okay. Those are the results. Let's take a look. So it's the same blood group, which means our genotype don't change. Just gonna write it out again. We'll have 1, 1, 2, 2, 3, 3, 1, 2, 2, 3, and 1, 3. It's just the different combinations of these things, right? And for phenotype, now we have a codominant. Okay, so if it's 1, 1, 1, 1, then we will just call this fluffy 1, right? Because it's just 1. It's like IA. You would call the type A blood, right? 2, 2 is gonna be fluffy 2, as in, you know, IB, and then 3, 3 would be fluffy 3, as in little I, right? So those are the easy ones. It's like when you have combinations, when you're heterozygous, then you need to think about it a little bit more. Okay, if it's 1, 2, what should we call this? Well, in this case, they're all codominant to each other, so this would be like fluffy 1, 2, right? It's like IAIB. You don't call it A, you don't call it B, you call it type AB blood, right? Same thing here for 2, 3, and it's fluffy. I should pick an easier name to write. Fluffy 2, 3, and 1, 3 is fluffy 1, 3, right? So 1, 2, 3, 4, 5, 6. The correct answer is D. Okay. Any questions before we move on? Hey, don't just memorize the answer, right? Like on the test, you have to understand, you know, what's codominant and what's dominant, and it might be a combination of these things. Make sure you read the questions carefully. All right, moving on. Pedigree. There will also be pedigree questions on the test, but it won't be more difficult than the ones that we've done. Okay. You see something like this, the first thing you should do is to write out the genotype of people that you're certain of. And those would be individuals with type O blood or type AB blood, right? There you go. And then everyone else is just half of the genotype. The other half we don't really know. Okay. So then you gotta do some detective work, right? We have type O lady here, and the little I must have inherited from each of the parent. So like a, one from this parent, and then one from the other parent. And let's take a look at some of the other kids here. This one has an IA, and can you tell based on this family tree whether the IA came from the mother or her father?
The mother?
How do you tell?
Because there's only one A present, the other one just BB.
Exactly. These are all B's, right? It's impossible to get it from the paternal side, right? So this IA has to came from this particular family right here. And that tells us this question mark over here is IA, little I. Very good. And so this B must have came from here, right? And that's it. Right? We don't have to finish the whole tree, right? Because the question only asks you for the question mark individuals. Okay. Also look through the one that we did in class when we had the lecture, right? I don't have the slide with me right now, but remember it was what was it, like John and Harriet, that one? It was one of the poll questions. So yeah, review that one as well. Okay, let's see. We have some random multiple choice here. Let's do them. Go ahead. Oh yeah, I didn't post the answer key for study guide 4. Ooh, thanks for letting me know. I'll do that right now while you guys try to choose the answers. Did I post the class notes or did I not do that either? I also did not post the class notes. Oh my goodness. Okay. Just give me a second, guys. Let me do that before I forget. Too many things going on sometimes. I just don't remember. Class notes is this stuff, right? Yeah. Export. And while you wait for me, you can try the next question as well. Okay, so the class notes and answer key for lecture 4 is now available. Right, thanks for reminding me. Next time, just send me an email if you don't see it on the next day. Because like on Monday and Wednesday, I have like back-to-back classes, and sometimes I just forget to do it afterwards. Okay, so the answer For number 6 is, let's see. So a drop of Ceres blood is mixed with anti-A and so on and so forth. You might remember this thing, right? Those plates. Right? So you have A here, you have B here, and anti-Rx here. So no reactions in any of them. And what does it mean? Well, no A, no B means you're type O. No RH means you're negative, right? So Sarah does not have any ABO or RH antigen on her RBC. That's the correct answer. Okay. Let's take a look at why some of the other ones are not true. Sarah's blood is O positive. Well, it's not positive because there's no reaction with anti-RH. Okay. None of the antibodies in Sarah's plasma reacted with the antibodies. This is not correct at all, because when we do these kind of blood tests, we don't add the plasma, right? We just add the RBC. And so her antibodies would have nothing to do with this test. The test must be defective because clumping should be seen in at least one of the tests. That's not true. Okay. You can have absolutely no clumping at all. And that would just mean that you're O negative. Okay. All right, let's try the next one, multi-select. Select all the safe transfusion. All right. Thank you for those of you who have selected something. And the safe ones are B, C, and D. Okay. Positive cannot be given to negative. That's why the first one is not safe. For the same reason, the last one is also not safe. Okay. All right, moving on. Next, we have a chart with a bunch of cells, and we will just fill them in. First one is a macrophage, and you probably remember by now that macrophage, they came from monocyte. And how do we classify macrophage? Well, macrophage is generally considered as a phagocyte. That means they just go around doing phagocytosis. And they also plays an important role in triggering the adaptive immunity. And so for that reason, we call them antigen presenting cells. Antigen presenting cell, or APC, right? And then the last one, because they originate from monocytes, we can classify them as agranulocytes as well. Okay. So some classifications are based on morphology, what they look like. Some classification are based on their function. So main function is to recognize PAMs and perform phagocytosis. Okay. Antigen presenting or antigen presentation activates naive T cells. Okay. So we talk about HIV, the virus that cause AIDS. They infect these macrophages and kill them. Excuse me. And once you lose these macrophages, you lose your entire branch of adaptive immunity because there's no way of triggering them. Okay, neutrophils. Neutrophils are basically granulocytes. And they are also phagocytes because they are also capable of doing phagocytosis. Main function, just phagocytosis. This is not really a function, but something to note. They are the most abundant WBC. Next, we have the mast cells and the basophil. And just probably worth writing it down. The mast cells are anchored to tissue, and the basophil, they are in circulation. So this is granulocytes. These are cells where you can see their visible granules. And you probably remember what kind of chemicals are in the granules of mast cells and basophil, right? So trigger inflammation by releasing histamine. Right? So like I said, mast cells is for like localized inflammation, like cutting a finger. And basophil, this is more for like systemic, bodily, right? Entire body inflammation. Okay. All right, I'm just gonna give you a moment to catch up with these copy. I will be right back. Okay, next on the list, we have the NK cells. NK cells stands for natural killer cells. Natural killer cells. And I know we didn't really introduce that until lecture 3, right? It's not really part of our granulocytes or granulocytes classification, but we know this is part of the innate immunity. Innate immunity, right? In fact, all these things are part of innate immunity as well, right? And the function of the NK cells is to kill infected cells and tumor cells. Next, we have the helper T cells, which is part of the cell-mediated immunity, right? It's part of the adaptive immunity, of course. And the function of helper T cell is to activate naive B cell and help coordinate immune response. Right? Just like the APC will activate the naive T cell, we will need the helper T cell to activate the naive B cell. Okay, plasma cell is an effector of B cells, and that would be part of the antibody mediated immunity. Of course, that is another branch of the adaptive immunity. And the function of a plasma cell is just to mass produce antibodies. Okay. Just random things that I remember about antibodies all of a sudden. You should know that they are Y-shaped proteins. There is a constant region here. And then these are the variable region, right, for binding. Oh yeah, sorry, mass produce antibodies. Thank you. So that's the Y-shaped protein, right? Variable region that binds to the antigen that they recognize, and antibody works by neutralizing toxin and viruses, right? Forming immune complex, and making it really big, right? Large clumps that would allow phagocytosis to happen quickly. And the last one is that it will help with activating complement. Activates complement. All right. And these are the strategies that we use to clear the pathogen, to clear the infection. All right. Okay, let's do another question here. We're doing number 9. Go ahead. Okay, that was a minute. And most people got it right. The correct answer is E, but let's take a look at why. Specific means the like the one that we're gonna get when we activate the T cells and the B cells, right? So these are the adaptive immunity. Non-specific is the one that we are born with. And so here it says specific immunity works only after non-specific defense have failed. So that's not true. A lot of times they actually can occur simultaneously, right? Parallel to each other. So that's not it. Non-specific defense and specific immunity require prior exposure to be effective. That's not true. Non-specific ones does not require prior exposure. Okay. B cell works in both non-specific and specific. It only works in specific, of course. T cells also only works in specific immunity, and that's the answer. Specific immunity changes throughout a person's lifetime because you get exposed to different things and then you gain extra immunity over the course of your life. That's why it's also called adaptive immunity, right? Okay, number 10 here. Let's give that a try as well. All right, this one's kind of all over the place. Let's take it up. Which of the following statement describe a form of acquired immunity? Okay, so acquired immunity means you have to catch it, right? Okay, so let's see. A RhoGAM injection is an example of artificial active immunity. That's not true because first of all, RhoGAM shot is a type of passive immunity, right? So you're not acquiring anything, so that's wrong. And secondly, RhoGAM shot over here is an example of natural passive. So it's not natural, right? It's supposed to be artificial. Okay, so those are not going to be the answer. Nursing an infant to provide the antibodies in breast milk is an example of natural active immunity. So that is passive, not active, because the baby did not produce the antibodies itself, right? The mother is simply transferring the antibodies into the baby. So that's the mistake right there. Catching COVID-19 and recovering from it should give you natural active immunity. So natural is correct because you are catching the COVID-19 by natural means. You're not injecting anything into your body. And it's active because your system has to fight it off, has to produce the antibodies. And to recover from that and gain long-term protection, that's the correct description. Receiving mRNA COVID-19 vaccine is an example of getting artificial passive. The problem here is passive, right? The mRNA will create the viral proteins and you will still have to make the antibodies against those viral proteins. So that's the problem with all the circle ones here. Does that make sense? What did people choose anyway? Let's see. Okay, so D was still the most popular choice, but everyone else who chose something else, do you guys understand why they are not correct? All right, next one. Name the cell. Uses porphyrin to put holes in infected cells. That would be the job of cytotoxic. Cytotoxic, or also called killer T cell, right? They would use porphyrin to put holes in the target and then pump in toxins, right, to kill them. Release histamine to initiate local inflammatory response. That would be mast cell. A type of APC that activates naive T cell. We only learned one. That's a macrophage. Kills cancerous cells, NK cells. Part of the innate immunity, right? Forms blood clot. It just has named the cell, right? It doesn't have to be a white cell. Platelets. Most abundant WBC neutrophil. Okay, give examples of each of the following. Formed elements, that includes all the cellular components of the blood. So red blood cell, white blood cells, and platelets. And let's write their fancy name as well. Erythrocyte, leukocyte, and this one is a thrombocyte. Granulocytes here, we have neutrophil, basophil, and eosinophil, right? The one for fighting parasites, if you recall. Lymphocytes, they are T cells. And B cells. They both come from the bone marrow, of course, but T cells, they will move to the thymus where they continue to mature. But the B cells will stay in the bone marrow to mature. Proteins that are needed for coagulation, prothrombin, and fibrinogen. And autoimmune disease, I mean, there are a bunch that you can name, but the ones that we talked about were like Graves' disease. Graves' disease. I think that's probably the only one that was in the lecture notes, right? So, you can make up another one that like multiple sclerosis. That's the one where the T cells attack your neurons, so they lose their conductions. We will learn more about that in the next unit. You probably know a few other, right? Like ALS, lupus. Okay, physical barriers. We have intact skin. Normal flora. That's the one that people usually forget. That's the beneficial microorganism that lives on us and in us, right? They take up so much space that it leaves no room for the bad ones. Immunodeficiency, there is AIDS, which is considered as secondary because you have to contract it, you have to catch it after birth. And then there is the primary immunodeficiency, which is something that you would be born with. And that's the bubble boy, right? SCID, severe combined immunodeficiency. Lymphatic organs. Again, we have a bunch from the diagram. Spleen, appendix, thymus. Right? Tonsils, lymph nodes, all these things will work. Although lymph node, it's not really an organ, it's more like a structure, right? Okay, artificial passive immunity. Right? Just give you a moment to think about that. An example of artificial passive immunity. Serum, right? Remember I told you I get bitten by the dog? I had to get serum. Natural passive immunity, that would be like breastfeeding. Characteristics of inflammation, we have redness, swelling, pain, and warmth. The pain and the swelling is caused by the increase in permeability, whereas the redness and the warmth is caused by vasodilation. More blood is coming, making it red, making it warm. All right, next question here. Why do we need to receive a flu shot each year in order to have protection against flu virus? Okay, let's go through the choices together. They are all booster shots to strengthen the immune system. Okay, so we talk about, right, the flu mutates every year. That's why we need to have new shots, right? So it's not about getting booster. Each year, the dominant strain of flu virus circulate changes. That's the right reason. It's a way for a pharmaceutical company to make lots of money. Certainly, that's what some people think. Think it's like a conspiracy or something, but that's not the reason. Memory cells generated will last for a lifetime, not just 1 year. When we say lifetime, like a long time, but eventually, sometimes they do become ineffective after like 20 years, 30 years, depending on what kind of protection you're talking about. Like tetanus, for example. After 20 years, you're gonna need a new shot. Otherwise, you're not protected anymore. Number 14, I think this one we did in our lecture as one of the poll questions, and the answer was B. Okay, you can go back and check it yourself. All right, so here is this graph again. Let's see what we can label. What is the expiratory reserve volume in this of this person? So expiratory reserve volume refers to from here to here, right? Okay, that's the ERV. So, I'm gonna say this is about 1500, 2500, right? 2500. And this might be around like, it's hard to tell. We'll say 1200. I mean, on the test, if I'm gonna ask you something like this, I'll give you a better graph, right? And you're just gonna subtract these ones. So that's like about 1300. Do you understand? So this is ERV, right? The amount of air that you can voluntarily expel after a regular exhalation. What is the label for B? B is from here to here. right? So it represents the total volume of air that you can move in and out of your system. That would be vital capacity. Describe the breathing pattern for the person. So this is just tidal volume, inhaling, exhaling regularly, and then fully exhale, and then go back to regular breathing. And here you have fully inhalation. Right? Inhale as much as you can. That would be, the label C, which is IRV, inspiratory reserve volume. Okay? And then you exhale back to normal and breathing. Inhale as much as you can, and then from that point, you exhale as much as you can. Right? So the amount of air that you just breathe out from this point to this point, that represents the vital capacity. Describe the volume label as A. Anybody want to help me out here? Do you remember what this is? This volume that is not part of the graph, but nevertheless is in your lungs.
The residual volume.
That's correct. That is the residual volume. Thank you. And like I told you, right, this is dead air. Very high concentration of carbon dioxide is not used in gas exchange. What condition would cause the residual volume to increase? Anyone remember? We learned that last week. What condition will cause the residual volume to increase? Yeah, emphysema, that's right. And some people say COPD. Yeah, that's also correct. But because COPD includes emphysema, right? Okay, so COPD is chronic bronchitis plus emphysema. Like that's like the clinical definition. Right? If you have both of these, then you have COPD. And in these cases, you would have increased residual volume, which lower your gas exchange efficiency. Okay, draw a flowchart to illustrate how inhalation and exhalation occurs. This is something that you should do on your own. We did it last time already, right? Like with the notes. I just posted the notes, on eCentennial, so you can go through these things, and you definitely need to understand how the rib cage and the diaphragm moves to create the different pressures and so on and so forth. And it would be beneficial for you to write it out once yourself. Okay, let's take a look at some of these questions. Go ahead, number 17.
Oh, you got time to the gym today. I'm in the gym in like a year.
Okay, the answer here is the larynx moves up against the epiglottis. Right, I told you to put the hand in the throat, remember, and you swallow, and you feel it moving up and pressing against the epiglottis. So, it seals up the trachea when you swallow. Okay, we're just gonna do these two together. Surfactant in the alveoli helps. Remember, the surfactant is produced produced by septal cells. And its job is to lower the surface tension, right? And the more surfactant you have, you will have an increase in compliance, the expandability of the lungs. So the correct answer is to decrease surface tension to allow inhalation. We talked about premature babies. They don't produce their own surfactant yet. That's called infant respiratory distress syndrome. It's something that you should review as well. Hey, last one. The urge to breathe is primarily driven by an increase in carbon dioxide in the blood. Okay, so it has nothing to do with the oxygen. It's just having an increase in carbon dioxide, and that would trigger you to breathe. Okay. That's it for the review. I mean, it's pretty straightforward, the test, I would say. It's certainly not going to be too difficult relative to the quiz. It's about same level of difficulties. You will have some, application questions, and people tend to, based on the quiz results, right? I think people are struggling the most with the multi-select questions. So you might want to pay extra attention for those, right? Just have a really good reason of rejecting something when you choose to not click the box, right? Don't just randomly click them, right? Try to do what we do here by correcting the choice. Where's the one? Like for something like this, right? Like you want to be able to rule out certain choices by making changes to it, right? If you can really deliberately point out what exactly is wrong with that sentence, then maybe nothing is wrong with it. Okay. Yeah. So good luck on Wednesday. No class on Wednesday again. The next time we meet will be the following Monday. And if you need help between now and the test, feel free to email me. All right. Good luck, guys, and I'll see you next week. Bye for now.